Kelly, we're good.
Okay. Yep.
Good afternoon, everyone, and welcome to this Black Equity Coalition, aka BEC, panel discussion. I'm Liv of the BEC, and I'm going to toss it over to our panelists to introduce themselves, starting with Dr. Conti.
Hi, I'm Dr. Tracy Conti. I am the Executive Vice Chair in the Department of Family Medicine at the University of Pittsburgh, and also serve as the Program Director for the UPMC Family Medicine Residency in McKeesport. I'm one of the leads of the Community Advisory Vaccine Group for UPMC.
Dr. Johnson.
Good afternoon. I'm Denise Johnson. I'm the Acting Physician General at the Pennsylvania Department of Health. I'm coming on board from a position as a Chief Medical Officer at Meadville Medical Center Community Health System in northwestern Pennsylvania, and right now leading some of the state's efforts on vaccination.
And Dr. Gary Webb.
Hello, I'm Tiffany Gary Webb. I'm Associate Professor and Associate Dean for Diversity and Inclusion at the University of Pittsburgh Graduate School of Public Health. I'm also part of the BEC Data Committee, where we work to a data to action approach to deal with equitable response to this pandemic. Excited to be here.
Thank you all for your introductions. We will start out with 2 questions for each panelist. But the purpose of today's event is really to gather your questions and answer your questions. So please, while we're asking our prepared questions, be thinking about your questions, because we will want to hear from you. That goes as well for you, as well as those that are virtual today. There are folks monitoring the chats, and they will feed us your questions as they are asked. So please put your questions in the respective chat of wherever you are virtually. So we're going to start our panel off with asking Dr. Johnson a couple questions. So Dr. Johnson, how did the state of Pennsylvania address vaccine hesitancy among Pennsylvanians, particularly minority communities, during the pandemic?
Well, thank you. The Department of Health has done a lot of work around hesitancy throughout the Commonwealth, and including in minority communities. We have had regular meetings with over 300 community partners in our COVID-19 health equity response team. And so with this group, they've done a lot of work. Some of the initiatives that they've done were working with faith-based organizations to help them reach out to their communities, and also find providers to partner with them so that they could offer vaccinations and testing in their houses of worship. So these have been done in churches and mosques and other places, trying to get those services to those communities. Early on, the Pennsylvania Emergency Management Agency also worked with the Department of Health to bring testing, but also vaccination, especially when we were trying to get the 1A and 1B priority groups. So many clinics were set up to get these groups in to get their vaccinations. We've also worked with the area agencies on aging, especially to reach those homebound populations. There were many that weren't able to get into the mass vaccination centers that were set up at the time. And so providing vaccinations in the homes were some of the initiatives that were undertaken then. We continue to do several other outreaches, especially with mobile clinics. So going out to communities so that those people don't have to travel to vaccination sites, to bring education, but as well to bring vaccinations. And then also working in other facilities like schools and other places where people might gather to be able to get vaccinations to them. We also have been working on education. So we have a media campaign that has billboards and print and digital media, radio, but we have been also creating material in different languages, as well as reaching out to community organizers to help to carry those messages. So those are just a few of the efforts that the department has undertaken to try to make sure that we're getting vaccine throughout the Commonwealth to many different communities and groups.
Thank you so much, and I can definitely attest for the church partnership. My own church, Macedonia, had a clinic, and we're right around the corner from Mount Arid, who also did work with vaccination distribution. So I saw that in real life. So thank you, Dr. Johnson, for that work. Second question, in addressing this hesitancy, has it ensured that discrimination will be absent from the COVID-19 vaccine distribution?
So our priority is to make sure that we get to everyone who's eligible for vaccine, and we want to do it in an equitable way. So there's no room for discrimination, so we are trying to make every effort to make sure that we have equity. We know that communities of color have been more heavily impacted by COVID and continue to have to be under-vaccinated for a variety of reasons. So we're, as I said, really trying to get the message out to those communities. We've learned that the messenger who brings the message is just as important, or maybe more important than the message. And so creating information in different languages, using other community partners to take that message has been really important. We have a weekly newsletter that has updates that's available in Spanish and English. We also have our website that's accessible in different languages. We also made sure that we created a hotline so that people can call if they don't have internet access and have difficulty with getting a vaccine. As I said before, the mobile clinics have been important. I've been spending some time going around the state to look at some of the efforts that we have in terms of mobile clinics. We've seen mobile clinics in action in the Harrisburg area. I've also seen Primary Health Net up in the Erie area, some of their vaccination efforts, and we've been doing that around the state. That's going to continue because as we get Pennsylvanians vaccinated to the goal of 70% of adults over age 18 being fully vaccinated, we know that we can't stop at that point. That there still are going to be communities where the vaccination rate is lower, and that can be due to access, so not having vaccine very convenient to you or at a time that you can access it because of work obligations and other things like that. And then also getting information, making sure that everyone has credible information so they can make the decision to be vaccinated, and also get the information in a language that you can understand from someone who looks like you or someone that will resonate with you to answer your questions, and also being able to provide opportunities like this where we have it open for you to ask your questions and get answers so that you can make that decision to get vaccinated.
Thank you so much, and yes, I live in a community that we have a large Somali Bantu population, so getting material out in a language that they will understand is definitely vital when we want to make sure that they're vaccinated. So thank you, Dr. Johnson. And now we're going to move to Dr. Conti and ask Dr. Conti a few questions about our work at the BEC. So first question, Dr. Conti, how has the Black Equity Coalition worked to encourage minorities to get vaccinated, and what has our success rate been?
The BEC for this over a year now has really tried to create a multi-sectoral approach to COVID within our communities, from testing and now to pivoting to vaccinations. I work as the one of the leads for the community health group for the BEC, along with Dr. Jerome Gloucester. And our group's goal is to really map out where vaccines are available for our community, as well as working with community partners to get vaccines out. And so the BEC has played a central role in bringing some of our larger vaccinators to the table in order to strategize where we have vaccines. This work goes across the BEC, not just within the community health group, but with our data group, and taking that information and then bringing that information to provide strategy to really go out to our communities. We've brought the health plans and the health teams together, such as UPMC and AHN, along with Allegheny County Health Department, and really focusing on those larger institutions and targeting vaccines into our communities. But in a community level, working with our federally qualified health centers, they are essential to providing health care in our underserved and minority communities, and making sure that they had access to vaccines, as well as a delivery system and resources to get vaccines to our communities. This is something that we will continue to work, and is even more important as we see hesitancy playing a bigger role in getting our communities vaccinated. Dr. Johnson mentioned education. That's also something that the BEC has tried to do, is partner and making sure that we get information about the importance of vaccinations, whether that be to a church group or to a community group, or in press conferences like this, so that our communities know how important it is, and can have a reliable, trusted source to get the information they needed. Dr. Johnson talked about people needing to see people who look like them. The BEC has done that, and we will continue to do that in the community, so that there are trusted professionals that they can go to answer their questions. We did a Trusted Matter webinar with WQED in order to get information out about COVID and vaccine, and separate myths from facts and try to address those. And we'll continue to do that until we have our communities vaccinated to the rates that we need.
Absolutely. Thank you, Dr. Conti. And yes, partnerships have been essential during this pandemic, and we have seen how those partnerships have worked. I specifically talk around the federally qualified health centers a lot, because they had the relationships prior to the pandemic, and why not leverage that to help get the vaccinations and do prior to that testing done in our communities. So thank you for that. Our second question is, what struggles have you run into, and how have you combated those struggles?
Hesitancy is a real struggle. It is so important for us to address hesitancy at the base level of what that hesitancy is about. And each community has different hesitancy around the vaccine. Some address it, we have to address why the vaccine, or why the perceived quickness of the vaccine came about, to historical atrocities that have happened to our communities that we have to be transparent about to address those hesitancies around that. There are different myths out there around infertility that we have to make sure we are giving trusted information about. The other struggle we initially had was really making sure that people had access to vaccines. When vaccinations first occurred, they were only in those larger mass vaccination clinics. And not everyone in our community could get to those sites. And the BEC played a central role in trying to ensure that vaccines were accessible where communities needed them, whether that be in a church, be at a community event, or be in a physician's office. And it's so important for us to continue doing that work to ensure access to vaccines.
Absolutely. I was just at the Juneteenth festivities in Chartiers, and there was a vaccination set up there. So those partnerships are, as you said earlier, are essential in making sure that we are placing the vaccine and meeting people where they are, instead of expecting people to come out into areas that they may not be able to get to access these vaccinations. So we're going to round out our prepared questions with Dr. Gary Webb. Again, reminder, this is for you to ask your questions. Yes, we prepared some to give you time to think of yours and to present yours. So we really expect to hear from you after these 2 questions to Dr. Gary Webb. So please put your questions in the chat, and our little studio audience that we have, please think of yours as well. All right, so Dr. Gary Webb, what is it going to take to hit the 70% or more mark of Pennsylvania's age 18 and older fully vaccinated?
So thank you for having me, and that's a very interesting question because we all want to reach a point, and you've probably heard a lot about herd immunity, where we have a large proportion of our citizens vaccinated, so it protects everyone. So I want to tell you a little bit about where we are right now. So our data committee has been tracking the numbers for the length of the pandemic. And what we focused on is equity and tracking numbers by race, by age, by geography, and really trying to understand not just the big picture of where everybody is, but for special populations. So we've been looking at COVID cases and hospitalizations and deaths over time, and now we're looking at vaccination. So as of today, in PA, everyone all over Pennsylvania, 44% of people are vaccinated. In Allegheny County, that number is 54%. But if you look at black populations compared to white populations, black populations are at 26.9% compared to 48.5% of whites. And so we've been looking at these numbers and really trying to figure out what do we do about the numbers. So we interpret them, and then we work directly with our community health group and our community engagement group to figure out strategies of what to do. So some of the strategies that we've taken is to really map out, okay, so one is the who. We looked at, blacks versus whites. Really talk about geography. So with the vaccination rates, we're interested in knowing, and we have been working with the Allegheny Health Department to say what areas have a high percentage of people vaccinated and which areas have a low percentage. And then we talk directly to our community health group about areas that we want to put extra efforts in. So this is just some of the strategy that we're using to get things out in our communities.
Great, thank you so much. And she's so technical, I don't have anything to say. So my second question is, what tactics can the Black Equity Coalition take to help Pennsylvania achieve that goal?
So I talked a little bit about the data committee's work, and so for this I want to talk a little bit about the our community engagement group. So we really organically developed our community engagement group with people who were interested in this topic. They saw us, talking about the data and what can we actually do about it. So we have community partners at the table that are thinking about educational campaigns. So Dr. Conti mentioned a couple of them. We have the WQED video strategy. We also have the Share Your Vaccine Story. So community members, some of us in BEC have talked a little bit about why we decided to get vaccinated and what our experiences are with vaccination, so that, it starts a conversation about that. Our community engagement group has put out a newsletter, so we want to keep people informed of the work that we're doing and asking people to get involved. And so, we've worked from so many different levels, from the clinical level to the community level to the data infrastructure piece of it, that we're really looking at this issue very comprehensively.
Yeah, I remember we all posted our vaccination pictures of
Yes.
being vaccinated, so we were all trying to do our part to encourage our community and our sphere of influence to get vaccinated. So I have gone through all of our questions. Do we have any questions? I guess we'll start with the studio audience. Does anybody here have any questions for our panelists?
I'm still having a difficult time trying to convince some family members that they need the vaccine, especially when they're very vulnerable And at the same time, I understand their concerns. What's a good strategy for helping those who refuse to get the vaccine to understand the importance of it without creating a family crisis or losing friends and companionship because of that issue?
Honestly, it's approaching them respectfully, and not force feeding the message, but combating it with fact. And again, as I discussed that hesitancy, finding out what really is the hesitancy issue and addressing that specific issue. And knowing that change takes time. You're maybe one time can talk to somebody and they will change their mind, but sometimes it takes going back again and again to talk to them and have those trusted conversations. That's how you get people to be on board. Not everybody is going to get vaccinated, we know that, but we want to make sure that we provide the best opportunity for everybody to get vaccinated.
Thank you.
Thank you. Any other responses to that question?
I mean, I'll just say that I personally, so one of the things I think we need to consider with hesitancy is age, and that's something that we've been looking at. So early on, when mostly older people were eligible, we saw that the older people were going to get vaccinated. But then as the eligibility expanded and younger people were eligible, we saw a little difference in that data. And so I've been talking to a number of my friends, just the way Dr. Conti mentioned, giving them information and then, kind of leaving it alone. And then I have had friends that have come back later on and actually said, you know what, I'm going to get vaccinated, or can you help me get an appointment? And the approach that I normally use, which would be a little bit more forceful, I did not do that, and it actually has worked out. But I do want to mention that with thinking about younger people and hesitancy, some of the work that we want to do as a BEC is do some focus groups with younger people to really see the reasons, because the reasons may be different for the younger people than older people. So that's something that we will be working on, and then we can create strategies related to what we find out.
Yes, and I just want to agree with Dr. Conti and Dr. Gary Webb as well. People don't want to be shamed because they're not vaccinated, and people do have some valid concerns. Some of it is based on misinformation, but some of it is based on, valid history, valid anxiety, valid worry. And so, as you said, you want to be respectful and find out what the actual reason is for that individual person, because the decision to get vaccinated is a personal one, and there are many reasons for hesitancy, but they're individual in the person. So each person has a series of hesitancies that are different and unique to them. So listen empathetically and find out what the concerns are, and then provide that good information or a trusted person to get the information from, and then let them make the decision. So, we don't want to force or shame or coerce, but be empathetic and provide information and allow them to make that decision.
Thank you all for those great answers. And I see we have another question here.
Yeah, first to Dr. Gary Webb. You mentioned community engagement through WQED, sharing your story, vaccine stories, newsletter, personal conversations. How much have you seen that move the needle of late in particular? And to all of you all, in the nonprofit work that we have done and the small sessions that we've had with people, a general theme is, I will wait and see. They may get to that from lots of places, but I'll see if anybody's ears are falling off or fingers are, if somebody's dropping dead, because I don't trust those people, et cetera, and so forth. I'll wait and see. So how long might someone wait and see? How do we even address that?
So I'll just answer your question by saying that it's hard to, there are a lot of moving parts. So it's hard to attribute what's happening, to one thing that happened, so we know that we got testing in communities, and so testing increased. We know that over time, the case ratio for black to white was 2-3 times, higher in black. We now know that it's about 1.4 or 1.5 times, so it's decreasing. So, we can't directly attribute a lot of the activities to that, but we are monitoring numbers and they're going in the right direction. With the vaccination numbers as well, when community events started to happen, we saw vaccination rates in black populations increase. So that's going to be, an embedded part of our work in the future. We're going to have evaluation. We're going to be at the community events, asking people questions about what they want to see in the future and really talking to people. So we will have an evaluation strategy to try to, get at that question moving forward.
And just want to add that, yes, we can't relate cause and effect from each individual thing that we do. So that's why we have a wide range of actions, right? We've got the media campaign, we've got trusted messengers, we've got person to person. We're doing all of those because we want to increase the rates. And while the rates are still not where we want them to be, we're going to continue to use all of that. And we're going to use the input that we get from focus groups and other areas to refine our message so we add more initiatives to get people vaccinated. We're going to do everything that it takes because it's so important. Again, these disparities, the inequitable impact is something that we have to address, and we're all committed to do all that it takes. And the Department of Health has partnered with BEC because they have the trusted messengers. They are reaching out to people where they are and having those conversations. From a state, from a department level, we're not able to do that, and our department is not in the community. We don't look like the people who we're trying to take the message to, and so that's why we need these community partners to be able to help in our vaccination efforts.
And the wait and see question that you asked, the difficulty with that is that this disease can kill you. And that's what this vaccine is trying to do, is to prevent death. And so when we take the approach that we're going to wait and see, each person that does that is risking their life doing that. We know that overall the COVID rates have decreased, especially because of vaccination, but in that community that has not been vaccinated, those rates are still high, and the mortality in those patients is still high. So there are still people getting COVID, and there are still people dying from COVID, and that's what this vaccine will do, is to prevent that serious illness and death.
Thank all of you. I see a question from Bob over here.
Right. We've seen communities provide different incentives, everything from free beer to big ticket lotteries. Is there a role for incentives? Do they work in the way that we're people hope? Or is it better to just really focus our efforts on those conversations and kind of talking to people one-on-one?
So I'll take that. So I think we're still evaluating the benefits of incentives. I know we've seen all kinds of incentives all across the country, and I think it remains to be seen how effective they are in terms of getting vaccinated. Really, we have a huge incentive to be vaccinated. We know that the effectiveness of these vaccines is really not comparable to any other vaccines that we've had. These are extremely effective. And so that not getting hospitalized with COVID, not dying with COVID, not passing COVID to your loved ones is a huge incentive. Getting back to what we were doing before the pandemic and socializing and going around comfortable doing things are huge incentives. That being said, we want to get people vaccinated, and we are trying everything that we can do to get people vaccinated. There are many private organizations that are offering incentives within the Commonwealth, and we are encouraging that, definitely not discouraging. So people can offer incentives. We still are having the conversations, that's not off the table, but again, we know that we've got a great incentive to be vaccinated. And so what we're doing is providing the education and providing the access and allowing people to make that decision. But, you know, everything is still on the table until we get to the point where the pandemic is ended.
Thank you. And our illustrious leader, Mr. Fred Brown, has a question.
This is to the entire panel. Dr. Johnson, what is the state's position on addressing the comorbidity issues in conjunction with COVID, given that the pandemic really revealed a chasm between people of color, dominant culture with regards to health and well-being associated with diabetes, hypertension, obesity? And given that, is there a framework that you're looking at that looks at helping to explore the impact of COVID with those comorbidity issues to help really get the state in a position to really talk about the different approach that's needed to address the disproportionate impact?
Great. Well, I'm glad that you brought that up, because at a period of crisis, during a pandemic, is when we really can see the gaps that were there all along, right? And so that the disparities that we've seen in terms of access to testing, access to vaccination, the disparities that we've seen in terms of impact of the disease, those weren't developed, those didn't happen during the pandemic, right? They were there all along, and so the pandemic just really magnified it and amplified it. And so we would be, I think, remiss if we didn't take the lessons from the pandemic and make sure that going forward we address them. And so we've been learning a lot of things during this pandemic. So we're learning how to engage our community partners. We're learning how to be flexible in things that we didn't think we could do before. So, you know, making sure that people have access, even people who don't have internet, right? Providing telephone access for them. I think those are things that we had been hesitant to do before, but realizing they're really critical. Making sure that people have transportation to get to appointments. You know, again, that's something that, you know, we didn't do on a scale like we're doing now. And so all of those sort of things really need to remain. We also have been doing some work around health equity and looking at social vulnerability indexes and looking at where there are areas where people don't have access to pharmacies or don't have access to grocery stores, and that has impacted their health. All of those we do need to address going forward. So if we only get people vaccinated and get ourselves out of the pandemic, and we don't transform the way that we're delivering healthcare and the way that we are ensuring equity, then we're going to be at the same position with another pandemic. So the department has been looking at a lot of these areas that have been highlighted and working on addressing areas with a high social vulnerability index, not only in terms of vaccine, but also ensuring access to health care going forward. We also are looking at the disparities in terms of outcomes for patients and health impacts. So people need to have health care in a language that they can understand, healthcare that is culturally appropriate for them and culturally sensitive. And so as part of what we do moving on from the pandemic is making sure that there's equal access, that there's appropriate access, and that there is appropriate care going forward. So it's a huge task, but it really is going to take a transformation of the way that we're delivering healthcare now, and so that should look very different from how we have been delivering healthcare if we want to make sure that our citizens, each one, has an equitable access to healthcare, so that everyone has an equal chance to have a healthy lifestyle.
And can I answer a follow-up?
Absolutely.
Thank you. So gracious.
I'm at your service. So.
Dr. Johnson, my follow-up is, we are seeing early indications that people who suffer from COVID are experiencing post-COVID impacts on their health. How are we assessing what kind of services may need to be rendered that don't exist now that will have a direct bearing on supporting those individuals that are having heart issues and other internal issues that are COVID related? I don't believe we're prepared for that, but how do we begin to consider what we need to do as a society to address some of those people who may not be able to return to work? They may be permanently disabled as a result of that. And I don't think we think because somebody's recovered from COVID that they're ready to go back to work. And I'm seeing that that's not actually the case.
So this virus has been an eye-opener for all of us. I believe in the beginning, it's called a novel coronavirus because it was so new. There's so much that we didn't know about it. And there's so much that we thought we knew in the beginning that has really changed and evolved as the course went on. So we are learning a lot more about long COVID. So people who have had COVID, some of them severe, but some of them not severe, who later on have more health impacts. And as you said, heart issues, shortness of breath, fatigue, brain fog, all of these things that are persisting. And there have been studies that have shown that people who recovered from COVID, even if they didn't have a severe case, have more doctor's visits, a need for health care afterwards. And so that as we, again, learned from this pandemic, we've got to put systems in place for that. But that's not the only thing that, besides the gaps that were there before, we know that this pandemic has affected people in dramatic ways, whether or not they had COVID. So the rates of depression for not only kids from school, but adults with job losses or worries about health or all the different changes that they've had, we're going to have a huge impact in terms of the need for mental health services and supports. So we need to look at the pandemic broadly and shore up the systems that weren't working before, but we also need to be anticipating the needs, as you said, for the people who had long COVID, but also for the people who are developing depression and anxiety, and also for the people who had other impacts because they delayed preventative health care. They didn't get the regular vaccinations for their kids that they should have. So there's a lot to consider. And so again, I believe that we're gonna need to transform how we deliver health care because the little patches that we have done aren't going to set us up to weather another pandemic. And I think we all believe that it's not going to be if there is another health crisis, but when there is, and we want to be as prepared as we can for that.
Thank you.
So I have a question to kind of follow that up. There was some reporting that folks who had COVID and had long COVID or residual symptoms after recovering from COVID, loss of taste, heart, things like that, that receiving the vaccination sometimes helped to make them whole again, for lack of a better term. Do you all have any information or can speak to that in any way? Or did I just make that up?
So I have not heard that, but I do want to emphasize that even if you did have COVID, it's still important for you to get vaccinated. We do not know the lifelong immunity of COVID, and we know that with this vaccine, it's going to be another layer of protection so that you do not get COVID again. And so just emphasizing that point. I did want to talk about Mr. Brown's comment about, how are we going to provide resources? I think that's one of the growth aspects of the BEC with the community health group. That originally was just the testing group. And as we understood the need to be more than just testing from a health perspective and connecting communities to resources, utilizing the FQHCs as that base, and getting information and needs assessments at the time of testing so we could connect people to resources to address those things like preventive health and ensuring that people had a provider that they could go to if they were to become ill is so important in the strategy of the BEC.
And just anecdotally, I think we've heard some reports of people having some improvement in their symptoms with vaccination, but I don't know how many of those there are, if there is a study of that or not. We've heard that anecdotally, but I don't know if that's
anything that correlated the two as of
yeah, not that I know of at this point.
Can we hold 1 second, because we have a whole group of people who are virtual, and I do not want to forget about them.
I have those online questions.
Okay, so can we start like maybe asking 1 or 2 of those questions so they don't feel completely left out?
So one virtual question, 3 virtual questions that we haven't touched on yet. Is what progress is being made in clinics across the Commonwealth to consistently collect and report race and ethnicity data?
So that's something that has been a work in progress. I know that it's been months ago that the Secretary of Health has put out an order that really requires the collection of that data. That has been difficult to achieve because some people, when they are getting vaccinated, do not want to put that information. We also have a huge category of other, and so the other category that we're seeing in terms of vaccination for race is larger than historic. So that, whereas we would see a certain percentage of people who identify as other race in our vaccine data, that's a lot higher than that group has traditionally been. So it has been difficult. As I've been out to these communities, have been really encouraging people to put that data in, because it is helpful for us to make sure that all communities are getting access to vaccination, and we can divert our resources to get to areas that seem under-vaccinated, especially in minority communities. So we continue to encourage, but that is information that the individual needs to put on there. They have to self-identify. We have asked providers not to put that information in for patients. So we just continue to encourage.
And I'll just add, from the data group perspective, we've been, from the BEC, we've been an advocate for collecting of data by race and ethnicity. And we've also worked with the Department of Health to think about things such as data infrastructure, how the data can be linked to other sources so that we can get that information. So that has been also a critical part of our work, is to think about what are the problems in the data infrastructure and how we can, develop solutions to that. And then thinking in the future, when the next problem happens, that the data infrastructures are in place to be able to look at these issues preventively.
Another question from online is, when there's an autoimmune disease involved, what's a good approach for individuals to feel comfortable in getting the vaccine?
There are very few conditions that you cannot get vaccinated, but if you have questions, you should really work with your personal physician to address those. I know the tendency is to go to family and friends, but it's really your physician that can work with you.
I just have a quick question going off of that. Have you heard anything, or could you speak further on receiving chemotherapy and the vaccination? I feel like that's more of a hot topic. I've heard some talk.
Yeah, so for cancer patients, it's very important that they get vaccinated just because they are immunocompromised and they are at risk. It's important for them to work with their oncologist because the timing of the vaccine with respect to their chemotherapy has to be optimized.
Okay, great. Thank you.
And then there was another.
We actually touched on it already.
Okay, and then we had your question.
Yes, I realize that those of us who are in this room, and especially our panelists, are on the front lines of this and are people of goodwill and who've proven that they will press forward on this. I also know that when things drop off the front pages of the newspaper, it goes away. About 3 weeks ago, I was in Louisville, and I went to the home of Breonna Taylor, and there's nothing that indicates she was murdered there. Nothing. It is swept clean. I talked to some of the people, kids in the neighborhood. When did this happen? They said, oh, about a month ago. They have theories of why it happened, and it went into that. But it's gone. There's no, it looks like an apartment complex, an apartment building, no sign of it. I'm very concerned when I think of Mr. Brown's questions and others, that with all of our drive and will and good intentions, that while you all battle, this may fall away. This is not new. The disparities are not new. We know that, we've lived with it. It's become normalized somehow in our lives. And the meta-narrative is dismal. So there's great pressure politically, all kinds, for this just to go away. So when you all talk about the changes, I think it requires a revolution, and I'm wondering how we all play a part and don't give up, so that when the next pandemic or just life happens to our people, that we are not having this conversation again.
Well, I think you're right. There is an urgency now, and I think that, because we've all been so hit by this pandemic, this is a time that people are alert to it, and so that we have to be really urgent about making sure that things change, right? So this is the time to start putting systems in place that are going to address that while it's on people's memory, because if we do things as we normally do, just slowly and gradually, it will fall off of the consciousness, and it'll be a lot harder to impact. I think that right now, everyone knows that COVID has been impactful. Whether or not you're in a minority community, it's impacted all of us. And so I think we have a common conversation to have to make some changes right now. I think that you're right. If we wait months and wait a year, when people have forgotten it, it's going to be a lot harder to make the change. So right now that we have the momentum, we need all hands on deck, making sure that we again share the common story of the pandemic. I think that a lot of times if people think it will benefit only one group and not us in general, I think it's really harder to have that conversation. But right now we know that everyone's been impacted, right? And it's not been often that we have been able to say minority communities are impacted, healthcare organizations are impacted, businesses are impacted, farmers are impacted, everyone is impacted. And so that right now I think is a good time for change, because everyone is attuned to the conversation, and it's a conversation that you can have with everyone.
And from the BEC perspective, so Mr. Brown talked about the social determinants of health. And many of us had been working on the social determinants of health, in the health sector, in different sectors. So working in housing, working in education, working in the health sector. And with the BEC, we were able to come together in a way that we weren't before, right? So we're transformed in a way where our thinking is different now that we've been impacted by the other sectors. So we will continue to use that framework to move forward on other health inequities or inequities period in our communities. That's our plan, and we're pivoting to that now. I can also just speak to the commitment from the federal government. So we have a project here in Allegheny County called the REACH Project, the Racial and Ethnic Approaches to Community Health. And so we have that infrastructure that existed before COVID that was focused on chronic disease prevention. And what the CDC did is added additional money to that infrastructure to focus on COVID. First, it was to focus on flu, to make sure that we didn't have this, pandemic of COVID and flu at the same time. So can we outreach about the flu vaccine? Now we're doing work within that infrastructure on COVID. So I think in many ways, a lot of sectors have been transformed, and so that, it will hopefully, go into the future as well.
All right. I was waiting. You have anything?
No, everything's been said. It's
All
good.
right. Don't want to cut anybody off. So, thank you all today for your participation. I want to especially thank our panelists, Dr. Gary Webb, Dr. Johnson, and Dr. Conti. I want to now bring our illustrious leader, Mr. Fred Brown, up here to close us out with some remarks. Mr. Brown?
Well, this is such a historic day. Dr. Johnson, thank you for coming and spending some time with us. I'm honored that the Kingsley Association created this space for us in short order.
You're louder.
I'm excited that the Kingsley Association created an opportunity for us to use this space in such a short order of time, so I want to thank their staff for responding in such a rapid way to our requests. I want to thank those people who are online, who I know are busy, who have taken time out to listen to this very important presentation and discussion. I want to thank Dr. Johnson for her work, her tireless commitment to this work, in particular to equity work in our region, and how she's leveraging her platform to ensure that this work is being done across the state for all people, with a focus on ensuring that an equitable platform is being utilized to secure support and resources for those most affected. I want to thank the people in this room who I've been working with, in particular the BEC for the last 68 weeks, who have worked tirelessly to really hone this opportunity for us to create a very comprehensive response. We are very clear that this work cannot be achieved without collaboration. So I want to thank our partners who are in the room, Mercy, who recently came to the table with a potential collaboration that we'll be pressing forward with soon, and other partners who've been at the table since the very outset and beginning. Bob, thank you for your work. Gradick, he's been a terrific partner, as well as Pitt. Bethany, love you guys, terrific partners. And I don't mean to leave anybody out, but I just want to acknowledge that in the moment's notice, people step up for greatness, and it requires courage and a level of vision. And for us to reimagine a different reality requires us to be in the present and to align ourselves with partners who are thinking about not just today, but what can tomorrow look like that's different than yesterday. And that requires a level of support that we currently haven't had before. So Dr. Johnson, in an honest and sincere way, I really thank you for your clarity, your purpose, your commitment for being here. We hope that you lean on us in the future for future opportunities to really express our ability to support your work and the governor's initiatives. But more importantly, we're in this business to save people's lives. There's been a lot made about where people are, their hesitancy, those people who are justified in not trusting the system. At the same time, you have trusted stakeholders here who look like you, doctors, epidemiologists, epigeneticists, bioethicists, leaders, who have also gotten this vaccination because, as Dr. Conti alluded to, there's a real measurable outcome, which is death. That's real and tangible. And also, you can expose your loved ones to something that you can't take back. And so, given that, I'm just honored and thankful. I want to thank the board of the Forest Funds, and I'd be remiss if I didn't talk about the Poise Foundation and the partnership with Mark Lewis. I also want to acknowledge Dr. Bogan and the support from Allegheny County Health Department. We've all grown over the last 68 weeks to become better partners and stewards of our very humanity. And this is not a journey that starts with an action that doesn't require multiple steps. It requires us to stay at the helm, to drive this forward and be committed to a measurable outcome. So thank you for this glorious moment. This is the beginning of a new future for us, a new way of looking at imagining a better health care system that supports us not just through this pandemic, but prepares us for future challenges, shocks, and stressors that we know are inevitable. So thank you, God bless you, wish you well, wear a mask, wash your hands, and watch your distancing.
I said we're gonna have to get together socially at some point. No, well, I'm there during the week, so I'm in Meadville, this week, and I come to Meadville on the weekends. But, so it just, kind of figured out, it's hard to have two households.
Yeah, so you will eventually do the move, you think?
I think I'm going to, because my mother and mother-in-law live with me, and so it's a lot to manage. Yeah.
What's the difference between